Hi, this is Sanya. I'm a trainee clinical psychologist and I'm currently working with a psychiatric hospital in Jaipur. COVID pandemic has hit us all very hard. It has affected us spiritually, emotionally, physically, mentally, and psychologically. The effects of COVID-19 pandemic are unparalleled. It has caused fear, anxiety, stress, depression, and you are not in this alone. There are ways to cope up with it, and I'll help you with it. COVID-19 pandemic has led to a lot of maladaptive patterns in us. There is a lot of emotional distress, there is a lot of fear. People who are already vulnerable to psychological problems, they are more vulnerable now because they do not have access to basic health care. They are therapists, they are psychiatrists. Even all of us have engaged in unhealthy patterns like increased screen time, we are having unhealthy foods, the exercise have reduced, which has led to obesity and decrease in our cardiovascular fitness. COVID-19 pandemic has also affected our economy very badly, directly or indirectly. The health budget of every country has now increased, which have led to reduce the GDP of every country. Even the small business owners are affected very badly. The general population is experiencing fear, stress, and anxiety of dying. They are blaming the people who are already affected, which have caused a global mental breakdown. A wide range of psychological disorders are found, like PTSD, depression, self-blaming, guilt, doubt, and even suicide. Now is the time to focus upon yourself, your mental health, and there are a lot of coping mechanisms, and I can help you with it. First, reduce the news intake. When I say reduce the news intake, I don't mean that you have to be ignorant and you don't have to listen to the news or follow the protocols given by the government. What I mean is reduce the time period of consuming the news and take it from a reliable source like WHO or your trusted news channel. Second, maintain a healthy lifestyle. How we can do it? Firstly, by maintaining a sleep hygiene. How? Firstly, you have to set your waking up and sleeping time. You don't have to engage in screen time 1 hour before and 1 hour after waking up. You don't have to take heavy meals after 7 and you don't have to drink caffeine after 7. Whenever you are trying to sleep, make sure that the lights are dim. It helps you in releasing melatonin, which is the sleep hormone. We have to make sure that we do not take our work to our bed. No household chores, no office work on your bed. Other thing we can do is stop sharing triggering news over WhatsApp and Facebook. We don't know the mental health of the other person who is taking that news and if that news is reliable or not. Next is engage in physical activity, maybe 30 to 45 minutes or whatever you like, 4 to 5 times a week. It will help you increase the endorphin level, which will reduce your stress. The other thing we can do is engage in some creative activity, maybe dancing, painting, writing, whatever you like. I know it's a difficult time and we are all missing our loved ones. So what we can do is, even if we can't meet them physically, we can connect with them virtually through video calls or phone calls. Whenever things get a little stressful and you feel that you can't manage your thoughts, you can take a piece of paper, just write them down. This is known as journaling. This will help you to identify your maladaptive thought pattern. And after all of this, if you still feel that the environment is getting a little bit overwhelming, you can contact your nearest mental health professional. Thank you.